Good afternoon, students. Thank you for coming to review the videos. We are going to talk about assessment and concept of care for patients with eye and vision problems. This is chapter 42. Remember that during this lecture, interactive lecture, you're going to see not only videos, but also you're going to come across some of my comments. One of them states that's good to know, meaning that it could be possible coming in the exam or in the quizzes. So take notes of those. That's good to know. Just to remind you, I'm not testing anything outside of the book. Everything have been carefully reviewed, so your questions reflects whatever is on each chapter of this book. Okay? Okay, let's start with this chapter. So the priority concept for this chapter is sensory perception. The anatomy and physiology of the eye is something that we are going to check in this video here for better understanding. I always think that the video speaks 1,000 words.
The location of the eyes enables us to see length, width, depth, and distance of an object. The eye has three layers: the sclera, choroid, and retina. The sclera is the outer white layer that maintains the shape of the eye. Muscles attached to the sclera control eye movements. Choroid is the middle layer that contains the blood vessels. The cornea is a clear circular area in the sclera where light enters the eye. The pupil is the circular opening in the front of the choroid. The iris is the colored smooth muscle surrounding the pupil, which adjusts the size of the opening according to the brightness of light. The lens is located behind the pupil and between the anterior and posterior chambers. The lens is a transparent, flexible biconvex structure that bends or refracts light rays, so they focus on the nerve cells of the retina. The chambers are filled with a watery fluid that gives shape to the eye and helps refract the light rays. The anterior fluid is called the aqueous humor, and the posterior fluid is called the vitreous humor. The retina is the inner layer and contains the nerve cells, the rods and cones, and the bipolar cells. Rods are sensitive to light but do not sense color. Cones sense color. The highest concentration of cones is in the fovea centralis. The rods and cones synapse with bipolar cells, which then synapse with the ganglia cells whose axons form the optic nerve. Light rays enter the eye through the cornea, pupil, and lens, where the light rays are bent or refracted to focus them on the rods and cones, which transmit the stimulus to the optic nerve and then to the occipital lobe of the brain for interpretation.
Okay, thank you very much. This was a great video. Just remember, dear students, that you need to be familiarized with the concepts. Be familiarized what is the sclera, the difference with the cornea, the difference between sclera and conjunctiva, what is the retina, and your aqueous humor and vitreous humor, because those are going to be the concept foundations for understanding cataracts and glaucoma. Okay, don't be confused with those terms. Okay, so we have reviewed the anatomy and function of the eye, and here you can see a diagram with a very descriptive explanation. Here you can see the movement of the vitreous humor and the aqueous humor. Vitreous is basically in the back of the lens, while the aqueous humor is in this area. Okay, and that will make the difference between open angle and close angle glaucoma. Okay, be familiarized with those terms. the external structures. The eyelids are thin, movable skin folds that protect the eyes and keep the cornea moist. The canthus is the place where the two eyelids meet at the corner of the eye. The conjunctivae are the mucous membrane of the eye. The palpebral conjunctiva is a thick membrane with many vessels that lines the surface of each eyelid. The thin, transparent bulbar conjunctiva covers the entire front of the eye. A small lacrimal gland, which is located in the upper outer part of each orbit, produces tears. Tears flow across the front of the eye, towards the nose, and into the inner canthus. They drain through the punctum, an opening of the nasal side of the eye the leech edges, into the lacrimal duct and sac, and then into the nose through the nasolacrimal duct. Okay, so there is another video to understand the muscle, nerves, and blood vessels related to the movement of the eye. I want you to pay attention to this, please.
This is Sarah with RegisteredNurseRN.com, and in this video I'm going to demonstrate how to assess the 6 cardinal fields of gaze. Now, why do we assess the 6 cardinal fields of gaze? Well, it tells us how well those extraocular muscles of the eyes are working, and there's 6 of them, along with allowing us to assess cranial nerves 3, 4, and 6. So what eye muscles are we assessing? We're assessing the superior rectus muscle, which helps us with upward movement of the eye, the superior oblique, which helps with downward and outward movement of the eye, lateral rectus, which helps with outward movement, medial rectus, which helps with inward movement, inferior oblique, which helps with upward and outward movement, and lastly, the inferior rectus, which helps with downward movement. And when we're performing this skill, we're going to have the patient move their eyes in the following directions. In the right upper part, the left lower, the left upper, the right lower, and then left to right. And while the patient is doing this, we are looking for a smooth motion of the eye, which would be a normal finding. We would not want the eyes to jerk or to shake as they move, and if they did, that would be known as nystagmus. And how we're going to do that is we're going to take our pen light, we're going to hold it about 12 to 14 inches away from the patient's nose. And Ben, what I want you to do is keep your head still, don't move your head, and just use your eyes to watch where I move the pen light. And as you're doing this, you're going to perform it in the 6 cardinal fields of gaze, and you're just going to move it, and you're looking for any involuntary shaking of the eyes. So here we go. Okay, so that is how you assess the 6 cardinal fields of gaze. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.
Thank you. Thank you for watching. Okay, that was a very nice video. Okay, so the muscles. We have 6 voluntary muscles rotate the eye and coordinate eye movement. Coordinated eye movement ensure that both eyes receive an image at the same time so that only a single image is seen. The muscles around the eye are innervated by cranial nerve 3, the oculomotor, the cranial nerve 4, the trochlear, cranial nerve 6, abducen. The optic nerve in cranial nerve 2 is the nerve of sight connecting the optic disc to the brain. Connecting the optic disc to the brain. Meaning, this concept, okay? Just remember this. If you don't pay attention to any eye disorder, you can have a problem in the brain, okay? Especially if it's an eye infection. So be careful with your eyes. The trigeminal nerve, number 5, stimulates the blink reflex when the cornea is touched. The facial nerve 7 innervates the lacrimal glands and muscles for lid closure. Okay, and we have a very nice picture here, and all the muscles involved in eye movement. The function of the eye. So far we have seen the anatomy of the eye, and the muscle movement. Right now, we're going to see the function. The four eye functions that provide clear images and visions are refraction, pupillary constriction, accommodation, and convergence. Okay, convergence. Refraction, pupillary constriction, accommodation, and convergence. Refraction bends light from the outside through the eye through curved surfaces and refractive media, and finally to the retina. Each muscle, each surface and media bend light directly to focus an image on the retina. Emmetropia is the perfect refraction of the eye in which light rays from a distant source are focused into a sharp image of the retina. That's emmetropia. You can see the functions of ocular muscles as she mentioned in the video. There are 1, 2, 3, 4, 5, 6 muscles are involved, and you can review that. Emmetropia is the ideal refraction. Then you have hyperopia or hypermetropia or farsightedness. And then you have myopia, nearsightedness. Errors of refraction are common. Hyperopia occurs when the eye does not refract light enough. As a result, images actually converge behind the retina. In hyperopia, distant vision is normal, but near vision is poor. It is corrected with a convex lens in eyeglasses or contact lenses. In myopia, what happens is that this occurs when the eye overbends the light and images converge in front of the retina. Near vision is normal, but distant vision is poor. Myopia, my eyes, my near vision, whatever is close to me, my is normal. That's a good way to remember. Myopia is corrected with a concave lens in eyeglasses or contact lenses. Astigmatism is a refractive error caused by unevenly curved surface or on or in the eye, especially the cornea. These uneven surfaces distort vision. So you know the astigmatism is a problem in the cornea. The surface is not well curved, it's uneven. Okay. Normal pupil is slightly dilated for moderate light. This is miosis. Pupil constricted when exposed to increased light. And mydriasis. Pupil dilated when exposed to reduced light or when looking at a distance. So here we have patient-centered care, older adult considerations, changes in the eye and vision related to aging. Most of them are very important, but the ones that I want you to remember are the ones that are highlighted, okay? Let's first check the video for Arcus senilus.
I want to talk about this white ring that sometimes you see around the cornea of someone's iris. And if this is a dangerous thing, what does it mean? What's the significance of it? Mainly you see this in older people. In fact, you can probably see this in the majority of people. Probably even 70% of everyone over the age of 80 is going to have this white ring around the iris. And it's called Arcus senilus. And it's nothing really to worry about. It's actually a cholesterol ring. What happens as you get older is your ability to oxidize cholesterol becomes less and less and less, and it can start to accumulate in certain parts of your body. It doesn't mean that your arteries are getting clogged. It has nothing to do with that. It just means that you're not fully oxidizing or burning some of the cholesterol, and it's backing up in certain tissues. Now, if you see this in people that are less than 40 years old, then this is something a little different. It could mean that you have a problem with lipids and cholesterol, especially LDL. And just so you know, I'm talking about those people who are doing a high carb diet, and the high carbs are being converted into the LDL, the bad cholesterol. I'm not talking about the person that gets on keto and goes low carb and ends up having higher amounts of cholesterol, because the type of cholesterol that's involved with that is a completely different breed, and it's not going to be the type that's going to accumulate on your tissues or inside your arteries. I'm talking about usually the person that has high triglycerides, high LDL, and they're on a high carb diet. But for the most part, if you are over 80 years old and you have this white ring, it's nothing to worry about. And it's not something that I would recommend as far as lowering your cholesterol and start eating low cholesterol foods. But I would recommend getting on a low carb diet, and that way your cholesterol profile will be in check with what it should be. All right, in summary, if you're a little bit older and you have this white ring, I wouldn't worry about it. So if you're enjoying my content, which I hope you are, and you're applying this knowledge to your health, and you have a success, I'd really appreciate you sharing your success story. So click the link down below to my website where you can upload your success story so you can help inspire others.
Thank you, Dr. Berg. He has a very nice channel with plenty of good information that is helpful to all nurses and anybody in the healthcare field. Okay, so you know the Arcosanellos. To summarize, if you see somebody with these Arcosanellos below the age of 40, that's when you need to worry about. Cholesterol can manifest with the Arcosanellos, and also there are little little balls or balloons in the upper lid. Okay, that is evidence that the cholesterol and triglycerides are out of range. Okay, so you need to pay attention to that. Why am I testing you on this? Because this is something related to nursing education. When you see a patient with that condition, you have to teach the patient about the proper nutrition, okay? About the cholesterol, what are high carbs foods, what they need to eliminate from the diet, okay? And that's very important. Also, what is good to know about the Arcosanillos is that they decrease um, in muscle tone, okay? Muscle strength is reduced, making it more difficult to maintain an upward gaze or a focus in a single image, okay? That's good to know. Okay, let's continue. Pupillary constriction. So we spoke about refraction, right? About the hyperopia and myopia. Now we are talking pupillary constriction. Remember, there are four functions of the eye. In constriction, pupillary dilation, which is mydriasis, and also we saw some pictures before, control the amount of light that enters the eye. If the level of light to one or both eyes is increased, both pupils constrict, become smaller, and this must happen in both eyes. The constriction must be in both, bilateral, okay? The amount of constriction depends on how much light is available and how well the retina can adapt to light changes. The process of maintaining a clear visual image when the gaze is shifted from a distance to a near object is known as accommodation. That could be the third function of the eye: refraction, constriction, and this is accommodation. The fourth, convergence, is the ability to turn both eyes inward toward the nose at the same time. This action helps ensure that only a single image of close objects is seen. So we're going to stop here, and then we're going to come back with eye changes associated with aging.